A question was recently submitted from a very anxious person who is unfortunately going through the experience of watching her mother die from stage 4 breast cancer. This is obviously a traumatic event for anybody, but particularly to see this happening to your own mom. So my heart clearly goes out to that person. But what sets in and what I sense from the email that she sent us at Breast Cancer Answers was, despite all of the fantastic things she's doing to screen herself, she's still considering prophylactic mastectomies because of, frankly, the trauma and the horror of watching her poor mom die of stage 4 breast cancer. I really get and understand that trauma. I really get and understand the fear that is going through this person. This person has also shared with me that she's having her mammograms done on a regular basis, that she's, bless her heart, having MRI examinations done. She's got a lifetime Gale risk score that's low, around 19% or so. She had a very distant relative who also had breast cancer. And so if you look at the overall data on breast cancer from the American Cancer Society, and we talk about a 1 in 8 risk, the fine print, the asterisk that should go with that says, yeah, you've got a 1 in 8 chance of developing breast cancer, but you've got to live to be age 94. So the lovely lady who has sent us this very passionate and concerning email is thinking, well, even though the odds are not overwhelming that I'm going to have breast cancer, I'm so frightened by the disease, I'm seriously considering prophylactic mastectomies. I don't give specific advice here at Breast Cancer Answers, but I would make this plea to the person. One, be in the hands of a high-end breast imaging center and a group of physicians, which it sounds like you already are, that are on top of the latest technologies to screen for breast cancer. And number two, remember that if you should develop breast cancer, literally over the rest of your life, that it's going to be detected early and very treatable with your undergoing regular screening. The issue of prophylactic mastectomies, I've dealt with this before here at Breast Cancer Answers. Yes, it does take away a lifetime risk. If a person like the one who sent us the email was gene positive and she's not, then you would reduce your lifetime risk of dying of breast cancer by 95%, but nothing is ever 100%. I never personally recommend prophylactic mastectomies to patients. Patients come to me requesting them. If it makes sense in their set of circumstances, I'm not at all reluctant to perform the procedure. But I wouldn't let the stressful time of watching a mother die of breast cancer prompt anybody into wanting to go and have prophylactic mastectomies. Please instead seriously consider staying in the hands of a very competent team of people, and it sounds like that's what you're doing, and then hopefully make the right decision for you. And I hope this overview is helpful for you and bless you during this very difficult time. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.